So today, this PowerPoint is on HIV in children. It's a very brief PowerPoint. I summarized all the material, and I'm only presenting what I feel you need to know. But it's always wise to read the text in your ATI book as well. Since this is a short PowerPoint and it's just some introduction to HIV in children, your student learning objectives are very simple. You should understand the lab values and why they're done, be able to understand the goals of the medication, and identify the correct nursing care. And HIV in children, HIV is a viral infection in which the virus primarily infects the T lymphocytes, which is part of the CD4 T cells, and it causes immuno dysfunction. Not only does it cause the immune system to be suppressed and not work properly, but it also can cause organs in the body to fail. And because of the immunosuppression, the child is left with a weak state that can be invaded by a lot of different types of bacteria. Without treatment, HIV will continue to replicate itself because that's what it does. It enters the body and goes into the T cells and then just keeps replicating itself over and over again. So treatment is necessary. HIV is the virus that can lead to AIDS, which is an advanced stage of HIV. So I looked up about how many children are born with HIV, and what I found is 90% of HIV infections in children result from mother to child transmission. It can be the virus is passed from the mother that has HIV to her baby during her pregnancy. It can be passed during childbirth or during breastfeeding. So we don't quite understand how it's passed, but we do know that it is passed. So HIV has several categories in pediatrics, and category N has no symptoms. Category A is the mildest symptoms, and there's several, but these are the most important symptoms that you need to know. Category B is it's moderately symptomatic, and once again, there's probably about 25 of them, but you definitely need to know these three. And category C is the severe, and as the others, the list is even longer, but these are the categories that you need to know. So, testing a child, if the child is older, 18 months and above, positive results will be from the immunosorbent assay and the Western blot immunoassay. But if it's a small baby, an infant to 18 months, positive results will come from the polymerase chain reaction and a viral culture. If you don't quite understand the different cells, a normal range for a CD4 cell is about 500 to 1500. I went ahead and got a little explanation for you that the CD4 and the T cells are white blood cells that fight infection. So of course we want that as high as possible. But a child with HIV, and as it progresses, the number, of course, of this immunity drops. So when the CD4 or the T cells drop below 200, the child will be diagnosed with AIDS. There's a list in your ATI on the antiviral medications. Do you need to know the names of them? No, just be able to recognize them. And a great way to recognize them is that all the antiviral medications for HIV, they usually end with AVIR. So that'll be a little bit helpful to you. These medications are given in various stages, even if a child is category 1 with no symptoms. The medication, there's one of the medications that will be given. And what they want to try to do is stop the T cells from reproducing. And to slow down the disease. The treatment will also prevent transmission of HIV to others. So the goal of the medication is to restore the immune function. Of course, many times these kids are also put on antibiotics, and sometimes they're put on antibiotics as a maintenance kind of thing to hopefully prevent bacteria from forming, but they always need antibiotics. And they're often given IV gamma globulin when they have serious bacterial infections. Nursing care for a child with HIV, of course, it's standard precautions. It's not contact. What it is preventing infection. So it's standard precautions. Good hand washing is very important. The child, many times they are anorexic. They don't want to eat. They actually, some of them, when they're really little, become failure to thrive. But it's really, really important to promote optimal nutrition. And so whether they can eat orally or they need parental nutrition, it should be high in calories and proteins. And supplements are always recommended. Good oral hygiene and skincare is very, very important because those are areas that could lead to bacteria. And it's important to encourage the parents to keep these children away from anyone who's ill because they are immunocompromised. Immunizations are very important, especially the pneumococcal and the influenza vaccine. And education is very important. So this is a short introduction to HIV in children. You'll probably, if you haven't already, discuss it in your adult med-surg classes. It's just so that you recognize it, you know how it's treated, and you know what the lab values mean. So a short one for you today.